If you're over 60 and you do this one thing every single morning, you're putting yourself at serious risk. And the worst part? Your doctor probably never warned you about it. I'm talking about something millions of people do without a second thought. Something that seems completely harmless, even healthy. But for older adults, it's one of the leading causes of preventable injuries and deaths. I'm going to tell you exactly what it is and why it becomes so dangerous after 60. The morning routine I'm talking about is jumping out of bed quickly when you wake up. That's it. Getting up too fast. It sounds absurd, doesn't it? How could something so simple be dangerous? But let me explain the physiology, and you'll understand why this innocent action sends hundreds of thousands of older adults to the emergency room every year. When you've been lying down for hours during sleep, your cardiovascular system is in a resting state. Your blood pressure is lower, your heart rate is slower, and blood tends to pool in the central parts of your body. This is completely normal. Your body doesn't need to work as hard to pump blood when you're horizontal because gravity isn't pulling blood down to your legs. But the moment you stand up, everything changes. Gravity immediately pulls about half a liter of blood from your upper body, down into your legs and lower body. Your brain suddenly has less blood flow. To compensate, your body needs to react quickly. Blood vessels in your legs need to constrict to push blood back up. Your heart needs to beat faster and harder. Your blood pressure needs to rise. All of this needs to happen within seconds. When you're young, this system works beautifully. You have what's called good orthostatic tolerance. Your body adjusts almost instantly. You stand up, maybe feel a tiny head rush for a split second, and then you're fine. But as we age, this system becomes less responsive. The medical term for this is orthostatic hypotension, which literally means low blood pressure upon standing. After 60, several things happen that make this problem worse. First, the baroreceptors in your blood vessels, which are the sensors that detect blood pressure changes, become less sensitive. They don't signal as quickly or as strongly that your blood pressure has dropped. Second, your blood vessels become stiffer and less able to constrict rapidly. Third, your heart doesn't respond as quickly to the demand for increased pumping. And fourth, many medications that older adults take make the problem even worse. Let me give you the statistics, because they're alarming. Studies show that about 20% of people over 65 experience orthostatic hypotension. By age 80, that number jumps to nearly 30%. But here's the scary part. Most people don't even know they have it because it doesn't always cause obvious symptoms. When orthostatic hypotension is severe, you feel it. You stand up and immediately feel dizzy, lightheaded. Your vision might go dark or blurry. You might feel weak or nauseous. In the worst cases, you completely lose consciousness and collapse. This is called syncope, or fainting. But in many cases, the blood pressure drop is enough to impair your balance and coordination without causing obvious symptoms. You might just feel a bit off or unsteady, which you attribute to being old or tired. Now here's where it becomes truly dangerous. When you stand up too quickly in the morning and your blood pressure drops, even if you don't feel dramatically dizzy, your risk of falling skyrockets. Falls in older adults are not like falls in younger people. When a 30-year-old falls, they usually catch themselves or bounce back up. When a 70-year-old falls, the consequences can be catastrophic. Every year, 1 in 4 adults over 65 experiences a fall. Of those falls, 20% cause serious injuries like broken bones or head trauma. Hip fractures are especially devastating. Studies show that 20 to 30% of people who break their hip die within 1 year. Not from the fracture itself, but from the complications: blood clots, pneumonia, infections, and the overall decline that comes from immobility. Even if you don't fracture something, a fall can cause a traumatic brain injury. Older adults are more prone to bleeding in the brain because the brain shrinks slightly with age, leaving more space for blood vessels to tear. And if you're on blood thinners, which many older adults are for heart conditions or stroke prevention, even a minor head bump can cause serious internal bleeding. But the consequences of falls go beyond physical injuries. There's something called post-fall syndrome. After one fall, many older adults develop a fear of falling again. This fear leads to reduced activity, social isolation, loss of independence, muscle weakness, and ironically, an even higher risk of future falls. It's a vicious cycle. And most of these falls happen at home, not on icy sidewalks or in crowded places, but in the familiar environment of your own house. And a significant percentage happen in the morning, within the first hour of waking up. That's because morning is when orthostatic hypotension is most severe. You've been lying down for 6 to 8 hours. You might be slightly dehydrated from not drinking water overnight. And you're often in a hurry to get to the bathroom. Speaking of the bathroom, this is where many falls occur. You wake up with a full bladder, you're half asleep, you quickly get out of bed and rush to the bathroom. Your blood pressure drops, you feel dizzy, you lose your balance, and down you go. Maybe you hit your head on the toilet or the sink. Maybe you break your hip on the hard tile floor. This exact scenario plays out thousands of times every single day. Let me tell you about certain medications that make this problem dramatically worse. If you're taking medications for high blood pressure, and most older adults are, these drugs lower your blood pressure throughout the day. That's their job. But they also make it harder for your body to compensate when you stand up. Diuretics, or water pills, make you urinate more, which can lead to dehydration and lower blood volume, compounding the problem. Alpha blockers, which are used for prostate issues in men and sometimes for blood pressure, directly interfere with the blood vessel constriction response. Antidepressants, particularly older types, can cause orthostatic hypotension. Medications for Parkinson's disease do the same. Even some over-the-counter medications like antihistamines can contribute. If you're taking multiple medications, which is called polypharmacy and is extremely common in older adults, the combined effect can be severe. I've seen patients on 5 or 6 different medications, each one contributing a little bit to the problem, and together creating a perfect storm for falls. So what's the solution? It's actually remarkably simple, but it requires you to change a lifelong habit. You need to get out of bed slowly and deliberately. Let me walk you through the exact technique that can dramatically reduce your risk. When you wake up in the morning, don't immediately sit up. Lie there for 30 seconds to a minute. Take some deep breaths. Move your arms and legs a little bit to get your circulation going. This gives your body a chance to start transitioning from sleep mode to waking mode. Next, slowly roll onto your side. Pause there for another 15 to 30 seconds. Then use your arms to push yourself up into a sitting position while you swing your legs over the side of the bed. Now you're sitting on the edge of the bed with your feet on the floor. This is the critical moment. Sit there for at least 1 full minute, preferably 2. Do not stand up yet. While you're sitting, you can do some simple movements. Flex your feet up and down. This activates your calf muscles, which are sometimes called your second heart, because they help pump blood back up from your legs. Clench and release your leg muscles. Take deep breaths. All of this helps your cardiovascular system prepare for standing. After sitting for 1 to 2 minutes, slowly stand up. Hold on to something stable like a bedside table or the bed frame. Stand there for another 15 to 30 seconds before you start walking. If you feel any dizziness or lightheadedness at any point during this process, sit back down immediately and wait longer. I know what you're thinking. This sounds tedious. It adds several minutes to your morning routine. You're in a hurry to get to the bathroom. But here's the reality. Those extra 3 minutes could save your life. They could prevent a fall that leads to a hip fracture, a brain bleed, months in a rehabilitation facility, or even death. When you frame it that way, 3 minutes seems like a pretty good investment. There are other strategies that can help as well. Stay hydrated. Drink a glass of water before bed and keep water on your nightstand to drink when you wake up. Dehydration worsens orthostatic hypotension. Avoid alcohol in the evening, as it's dehydrating and affects your balance and blood pressure regulation. If you need to use the bathroom during the night, which is common in older adults, the same rules apply. Don't jump out of bed. Take your time. Turn on a light so you can see where you're going. Many falls happen when people stumble in the dark. Consider the layout of your bedroom. Is there a clear path from your bed to the bathroom? Are there rugs that could slip or trip you? Is there adequate lighting? Simple environmental modifications can make a huge difference. Install nightlights. Remove clutter. Make sure you have something stable to hold on to. If you're experiencing frequent dizziness upon standing, talk to your doctor. They can check your blood pressure both lying down and standing up to diagnose orthostatic hypotension. They can review your medications and possibly adjust doses or timing. For instance, taking your blood pressure medication at night instead of in the morning might reduce morning orthostatic hypotension. In some cases, your doctor might recommend compression stockings. These help prevent blood from pooling in your legs. They're not glamorous, but they work. In severe cases, medications like fludrocortisone or midodrine can be prescribed to help increase blood pressure and reduce symptoms. Physical therapy can also be beneficial. A physical therapist can teach you exercises to improve your balance, strengthen your legs, and enhance your overall stability. Strong muscles and good balance won't prevent the blood pressure drop, but they give you a better chance of catching yourself if you do feel unsteady. Regular exercise is crucial. I know it seems counterintuitive to tell older adults to exercise when we're worried about falls, but appropriate exercise actually reduces fall risk. It maintains muscle strength, improves balance and coordination, and keeps your cardiovascular system more responsive. Walking, tai chi, yoga, swimming, resistance training, all of these are beneficial. Just make sure to work with your doctor to choose activities that are safe for you. Let's talk about warning signs that you might be at high risk. If you've ever felt dizzy upon standing, if you've had any falls in the past year, if you feel unsteady on your feet, if you sometimes need to hold on to furniture when walking around your house, if your vision goes dark when you stand up, any of these are red flags. Don't ignore them. Don't chalk them up to just getting old. Bring them up with your doctor. There's also a connection between orthostatic hypotension and cognitive decline that's worth mentioning. Recent research suggests that repeated episodes of reduced blood flow to the brain, even if they don't cause symptoms, may contribute to dementia over time. Every time your brain doesn't get adequate blood flow, even briefly, it causes a tiny bit of damage. Over years and decades, this accumulates. So preventing these blood pressure drops isn't just about fall prevention. It's about preserving your brain health. Another important point, orthostatic hypotension can be a symptom of underlying conditions. It's associated with Parkinson's disease, diabetes, heart problems, and disorders of the autonomic nervous system. If you're experiencing significant symptoms, a thorough evaluation is warranted to rule out these conditions. Now, I want to emphasize that this advice isn't about living in fear. It's about being smart and taking simple precautions. You can absolutely maintain an active, independent life, while also being mindful of your body's changing needs. The goal isn't to become overly cautious about everything. The goal is to identify specific high-risk situations and modify your behavior in those situations. Getting out of bed is one of those high-risk situations. Bending over quickly and then standing up is another. Standing up quickly from a chair after sitting for a long time is another. Going from lying down in a hot bath to standing up is another. In all of these scenarios, the same principle applies. Move slowly, give your body time to adjust, and hold on to something stable. I also want you to talk to your family about this. If you have aging parents, share this information with them. Many older adults are fiercely independent and don't want to admit they're experiencing any difficulties. They might hide symptoms or brush off concerns. Having an open, non-judgmental conversation about fall prevention can literally save their life. And if you're not yet 60, but you're approaching that age, start building these habits now. It's easier to maintain good habits than to change bad ones. Plus, some people develop orthostatic hypotension earlier, especially if they have diabetes, heart disease, or other risk factors. The bottom line is this: your body changes as you age. That's not a sign of weakness or failure. It's just biology. Your cardiovascular system doesn't respond as quickly as it used to. Accepting this reality and adjusting your behavior accordingly is a sign of wisdom, not weakness. That simple act of jumping out of bed that you've done every morning for 60 years without a problem can suddenly become dangerous. It's one of those tipping points where a small change in your physiology creates a significant change in risk. But unlike many health problems that are complicated and difficult to address, this one has a simple solution. Get up slowly. Take your time. Let your body adjust. 3 minutes. That's all it takes. 3 minutes of mindfulness every morning. And in exchange, you dramatically reduce your risk of a life-altering injury. You maintain your independence longer. You protect your brain health. You avoid the cascade of problems that can follow a fall. So starting tomorrow morning, I want you to try it. When you wake up, resist the urge to immediately sit up. Lie there. Breathe. Slowly move to sitting. Sit on the edge of the bed. Wait. Then carefully stand. Make it a ritual. Make it as automatic as brushing your teeth. Your future self will thank you.